everyone, Eileen Bayer of the Fam here. Welcome to another episode in our mini-series on epilepsy. And as you can see, today we are going to go over the causes of epilepsy, and we're going to cover from infants, from newborns, all the way up to the elderly. Excuse me. So, saying that, let's get started. Now you ask yourself, what causes epilepsy? Well, the causes of epilepsy vary by age of the person. Some people with no clear cause of epilepsy may have a genetic cause, but what's true of every age is that the cause is unknown. Okay? For about half of everyone with epilepsy, some people with no known cause, they have a genetic form of epilepsy. One or more genes may cause the epilepsy caused by the way some genes work in the brain. Now, the relationship between genes and seizures can be very complex, okay? And we don't have the genetic testing for all forms of epilepsy yet. Excuse me. So, about 3 out of 10 people have a change in the structure of the brain that causes the electrical storms of seizures. And some young children may be born with a structural change in the area of the brain that gives rise to seizures. About 3 out of 10 children with autism spectrum disorder may also have seizures. And the exact cause and relationship is still not clear. Also, infections of the brain are also common causes of epilepsy. The initial infections are treated with medication, but, excuse me, the infection could leave scarring on the brain that will cause seizures at a later time. And people of all ages can have head injuries, although severe head injuries happen most often in young adults. Now, in the middle age, things like strokes, tumors, and injuries are more frequent. In people over 65, though, stroke is the most common cause of new onset seizures. Other conditions such as Alzheimer's disease or other conditions that affect the brain function can also cause seizures. So now the next thing we're going to cover today is we're going to go over the common causes of seizures by age, starting from newborn, going through infants and children, and then children and adults, and then seniors. Excuse me. And that will conclude this episode once I'm done reading it. So, the common cause of seizures in newborns is brain malformations, lack of oxygen during birth, low levels of blood sugar, low levels of blood calcium or blood magnesium, or other electrolyte problems, inborn errors of metabolism, intracranial hemorrhaging, or maternal drug use. So there's a lot of reasons right there why newborns may have seizures. Now the next one is infants and children. There's not a lot on that. As far as infants and children, some of the things may be fever, which they call febrile seizures, brain tumors, infections, although the brain infections are very rare. And then we go to children and adults. When we say children and adults, we're now talking like teenagers to early 20s, young adults. Excuse me. And some of their common causes for them is congenital conditions like Down syndrome, tuberous sclerosis, and monofibromatosis, genetic factors, progressive brain disease, which is rare, head trauma. So you see, for different ages, there's different things. In seniors, though, it's mainly strokes, Alzheimer's, and trauma. And those are the different causes in the different age groups. Now, besides that, as you see here, epilepsy is not the only thing that causes seizures, okay? It's the top #1 cause for seizures. But also head injuries, like we said, a head injury, the scarring could cause a brain seizure. It could be the head injury could get treated and be okay, but the scarring from that injury could cause seizures. Low blood sugar is right there, the #3. Any condition causing low oxygen, which is what we mentioned in newborns, where the baby's not getting enough oxygen in the mother's stomach. Poisoning, like drugs and alcohol, can cause them. To give you an example of what they're talking about, for alcohol, they're called detox seizures. It's when a person has so much alcohol in their system that when they don't have it, they go into convulsions. That's called detox. Same thing with drugs. It's a withdrawal. They'll go into seizures if they don't have it. That's why a lot of times, unfortunately, with hardcore drug addicts, when they come off of it, they can't just get off of the drugs cold turkey. They have to have another drug to help wean them off of it. So, excuse me, it's kind of like a never-ending cycle with that, unfortunately. Electric shock can cause a seizure. Like if you get electrocuted, you can go into it. That's what they're talking about. High fever in infants and young children. We discussed that, where they call that fibro seizures. Brain tumors, which is one that my late husband had. He had 3 of them. They removed 2. The other one disappeared on its own. Praise God on that. I'm happy because it was in a bad spot. When they tried to take it out, they couldn't remove it. He flatlined, so. But that went away on its own, thank God. Complications of pregnancy, like what they're talking about, that is anything that goes wrong in the pregnancy can cause it. Excuse me. So those are the common causes of seizures and stuff. Now, before I let you go, I want to try to get this across to you, and I say this during every video because it is so very important. That we all learn to see with our hearts and not our eyes. I can't stress how, I can't stress enough just how important that is. To give you an example, I'm going to just give you a little bit of my life to let you know. I've been there. I've never said a cross word to anybody deliberately. When I have found out, I apologized quickly. But, when we're kids and we're young and we don't know, we don't think of things like that. That's understandable. Please forgive me for this cold. But, growing up, I was born with bad eyesight. Now, you can't put glasses on a newborn or somebody that's only like 1 or 2 years old because they're going to keep grabbing them. But when I was old enough to wear glasses, now before I get to that part, let me tell you how bad my eyes were. From the distance I am from here to the computer, which is maybe, I say in arm's length, okay? That's how close I used to watch TV. My mom would come in and pull me back, and when she'd leave, I would inch back to the TV where I was. Because that's where I could see the TV. I couldn't see it from back where she put me. And after doing that a couple of times, she brought me in to get my eyes checked, and that's when they found out. Well, I ended up having to have a patch on an eye, on my good eye, because I also have astigmatism, which is like a lazy eye. One eye goes in, it stays in, okay? But anyway, and when I was old enough to wear glasses, I think I was like 5. I don't remember the age exactly, but I do remember growing up in school with glasses. I was not comfortable because before the glasses, they tried eye drops and stuff. Like I said, they tried a patch, they tried eye drops, they didn't work. My throat is so scratchy. Anyway, the glasses I ended up wearing were what people call bottle cap glasses, and that's because they start off like thin, like regular glasses, but on the edge by the eye, not towards your nose, but by the eyes on this side here, they were like that thick, okay? And that's why they were called bottle cap glasses. And I had to wear them. I mean, I wore glasses all the way through school. And it still was hard even with glasses. I hated it. Growing up, I had to walk to the kids in my classes hated me because they would do their work and they couldn't leave because when the teachers wrote things on the chalkboard, I had to go walk up to the chalkboard and write it down that way. I could not do it from my chair. That's how bad my eyes were. And I got picked on a lot from it. I got called poor eye. And when I was a child, it bothered me. I mean, it really did. I got into fights all the time because of it, because I was hurt. I didn't have a lot of friends growing up because of it. Even through high school. I had some people that wanted to be friends, but not to laugh with me, but to laugh at me. And it wasn't nice at all. Now, some other people are a lot worse than me, and that might have been the straw that broke their back. I was fortunate enough to have a very loving family. My dad and I are still very close, and he understood a lot of things that I went through. Even in junior high and high school, I got picked on. When people go to dances, every girl wants to go to a dance. Dances to me back then, because of what I went through, were not fun. If I went to a dance, I would end up crying. I didn't go to my prom because of it. It's not a nice feeling to be on that end of the stick. For anybody that doesn't know of anything, it's not a nice feeling at all. It hurts. I mean, I'm over it now. I'm an adult. My philosophy is, this is me. Accept me for me. Because I'm not going to change for anybody. You know? But the reason why I'm bringing this up is because I've been in a couple of streams with some people, and I've seen where words have hurt. I've seen people crying because of words in actions that we don't think are major, but we don't know what that person's going through. And that's because somebody judged them with their eyes and not their heart. That's why seeing with your heart is very, very important, and I can't stress that enough to you. Because when you see with your eyes, all you see is the shell. And you prejudge. You don't even know what the person's like. You don't know what they're going through in their life. You don't know the road that they walked on or anything. I mean, admit it. YouTube is like the internet. It's worldwide. We're talking to people in different states. Texas to Florida, Indiana, Maine, Vermont, even other countries like Africa. So the only thing we know of them is what we see online. But that's not even a tenth of their life. You don't know what their life is like. Our tongue can be used as a two-edged sword. Look at it this way. You see, picture a piece of string, okay? And you see somebody hanging by a piece of string. Now, your tongue has the power to either cut that string and hurt them, or to be the lifting hand to bring them up. It depends on what comes out of your mouth. Now, you may think, well, I didn't say anything really bad. It may not seem bad to you, but do you know what that person's been through that day? Do you know what their life is like? No, you don't. There's no way you could, because you're not them. So remember, what comes out of here can either uplift or can tear down. And if you tear down somebody, you could be that straw that breaks the camel's back. I know me, I wouldn't want that. I wouldn't want that on my head, knowing that something that came out of my mouth caused somebody to take their life. That's a burden I would not want on me. I'd rather be the person to see somebody having a hard time to reach down and pick them up, uplift them, encourage them and inspire them. Let them see that life is worth living. Because believe me, it is. We're all uniquely made. We're all special. We were created to need one another. That's why we're on YouTube. Admit it, you're not on YouTube just to do something. The views matter to you. So yeah, you need people. Because what is your YouTube if people don't look at it? Not even if it's on YouTube. What good is a phone if there's nobody there to talk to or to text? What good is it for a letter or to go outside if you don't have somebody to talk to? The way we were made was to need other people. So encourage people, lift them up, see from here, from the heart. Your heart sees what's inside. This is just a shell. This doesn't matter. What makes a person is in here. And you're only going to see that when you see with your heart, not your eyes. So until next time, remember, you are uniquely made. I love you. You matter. Bye until next time.